So let us see why is there numbness of lower lip in fracture mandible. So the lower lip is, as we know, is supplied by the inferior alveolar nerve, which is the branch of the mandibular division of the trigeminal nerve. Trigeminal nerve is the cranial nerve 5, fifth cranial nerve. So this inferior alveolar nerve enters the mandibular canal through the mandibular foramen. It travels along the body of the mandible and it supplies sensation to the teeth of the lower jaw, to the gingiva of the lower jaw, and skin and mucosa of the lower lip. So that is the reason why when there is fracture of the mandible, this nerve is damaged and then there is numbness of the lower lip. In addition, there can be edema or hematoma formation, the soft tissue swelling or the blood accumulation around the fracture site can put pressure on the inferior alveolar nerve and it can cause numbness in the lower lip. There can be bone fracture displacement. It can stretch, it can contuse, or it can transect the nerve. So these are the reasons why there can be numbness of the lower lip, and a simple numbness of the lower lip in trauma can also point us towards the diagnosis of a potential mandible fracture so that it can be looked into.